A very warm welcome to the 2021 Developing Health course. And on this day one, we're going to look at developing resilience in resource-limited health systems. So a very warm welcome to you all. We hope you really enjoy the day and find it stimulating and valuable. We're going to focus on access to health care. Sadly, for many in our world today, that is a really big challenge. Many are living in overcrowded and difficult situations with poor sanitation and water supplies. And disease challenges can be very great because of these environmental issues. We live in a world of difference when we compare with the facilities available to others with multidisciplinary, complex intensive care facilities. What a contrast with this child and some of those in his household, where the health challenges and nutritional status all are difficult. So the United Nations drew up the Sustainable Development Goals, the 17 of them, of which the one we're focusing on, of course, is number 3, the one about good health and well-being. World Health Organization adopted this and focused on it and has built programs around it. The Global Action Plan for Healthy Lives and Well-being for All is an attempt to move this agenda forward. And they produced a document called Developing Quality Health Services, a global imperative for universal health coverage. One of the targets of the Sustainable Development Goals is to reduce global maternal mortality ratio to less than 70 per 100,000 live births. So when we look at the data for 2015, we sadly see that we're a long way from achieving that target. The areas in orange and yellow are all way out of that target that the Sustainable Development Goal has established. Now there are some good trends, and here for example the Uganda data up to 2017 does show a fall in the maternal mortality ratio. But note please that the y-axis does not go to 0. Nevertheless, we're encouraged that there has been improvement, and globally the maternal mortality ratio fell by 37% in the first 15 years of this millennium. But even so, in 2015 there were 303,000 deaths. That's more than one woman dying for every 500 births. A shocking statistic. When we look at the regional variations, again we are struck by inequality, and note that the African region is particularly serious. When we look at the progress against the Sustainable Development Goal indicators, we see that road traffic mortality has gone the wrong way. But the one we're interested in today, maternal mortality, has shown progress, but too slow to meet the target. The under 5 and neonatal mortalities have so far progressed fast enough to attain the target. These include the reduction of neonatal mortality to as low as 12 per 1,000 live births, and the under 5 mortality to 25 per 1,000 live births. Now you're all familiar with the physical map of the world presented in this sort of format. But if we adjust the size of the countries according to the data of different parameters, then the countries will look larger according to higher numbers. For example, if we look at births in 2020, we see the map is greatly distorted. In fact, 9 out of 10 countries with the highest fertility rate are in the African continent. And more children are born each year in Africa than are born in the Americas, all of Europe and Japan put together. And sadly, this is also reflected in the picture for neonatal deaths, where there's a gross distortion. Infant deaths show a similar pattern. Now again, we see some positive trends. For example, the infant mortality trend in Uganda, again, it shows significant fall, but again, the y-axis doesn't go to 0. And when we compare the under 5 mortality rate in blue with the neonatal mortality rate in orange-brown, we'll see that the neonatal rate has not fallen as quickly. 1 to 4 year old deaths in 2015 show the same sort of distorted pattern. If we say what are the causes of these, then we can see on the left hand side of this graph that things like pneumonia contribute 13%, congenital anomalies and other non-communicable diseases 8%, malaria 5% and diarrhea 8%. But my question is, what do you think is under the other side of the graph? Well, it's neonatal. You can see the neonatal contribution to under 5 deaths is very significant indeed, with intrapartum related complications including birth asphyxia 11% and congenital anomalies 5%, prematurity 16%. So neonatal care has to be an important focus as we go forward. Children are still coming in serious condition, and some of them are dying from diarrheal diseases when, if they had the right care, they would be resuscitated and they would improve. And of course, as with many conditions in medicine, prevention is always far better than cure. That's why malnutrition is such a big issue, because we see all of the other conditions worsen in children with malnutrition, and we'll be looking at that. So we should hope, of course, that the map for physician distribution should look the same as the maps for these mortality rates, because you would hope that the physicians would be where the greatest challenges are. But what do you think we're actually going to see? It's actually shocking how the distribution of physicians is not where they should be. You can see, for example, Africa is so tiny. India not too bad. If we look at more recent data for anesthesiologists in 2015, we see the same sort of pattern. So something is terribly wrong, and we need to do our best to address these inequalities. So over 930 million people spend at least 10% of their household income on healthcare. 100 million are driven into poverty each year through out-of-pocket health spending. And half the world's population doesn't have access to the health care they need. Very challenging statistics. But stop. We're not just statistics. We're individuals, and we're fearfully and wonderfully made in the image of God. And we read in the Bible that he who oppresses the poor shows contempt for their maker, but whoever is kind to the needy honours God. So we should care for the vulnerable across our world today. We know, for example, many children are looking after younger children, and that causes problems, and it also causes challenges for education. So one of the responses of the international community in the Sustainable Development Goals is towards universal health coverage, including financial risk protection. And that is measured by access to quality healthcare services and to essential medicines and vaccines. The World Health Organization, in conjunction with other agencies and countries, have formed a universal health coverage partnership. And this is seeking to help 115 particular countries towards universal health coverage. The indicators being how much service coverage is achieved and what levels of financial protection are put in place. Now, if we look at service coverage for universal health coverage in 2015, again we see striking inequalities, and again some areas are way off the targets. In addition, the WHO Global Strategy on Human Resources for Health, looking at the workforce planning, estimates that there will be a shortfall of almost 18 million health workers by 2030, particularly in low and low middle income countries. So this is one of the key challenges. If we look at the proportion of the population falling below the poverty line as a result of paying for healthcare, again we see inequalities, and we see some areas in red are way out of the target areas. On top of all these challenges, we have of course had the pandemic, and where there has been progress, we're anticipating that there will be regression. with interruption to immunisation programmes, and also some of the communicable diseases spiking because of service cancellations. On top of this, we also have challenges with collecting the data we need to assess progress and monitor the situation. And this 2020 World Health Statistic map shows that some countries are unable to report the indicators that are needed. So there's a challenge with health data as well. So the question then is, what can we do about this? Some of these statistics are very challenging. How do we actually implement change on the front line in a resource-poor setting every day? Well, we're going to share some practical ideas, and I invite you to come with us to Africa. We fly down to Uganda. We travel down to southwest to Kisisi Hospital. And we're going to, first of all, celebrate where we've shown adaptability in caring for some of our patients. Here are triplets born at 32 weeks gestation in the middle of the night, all with breathing problems. And without very expensive, fancy equipment, we were able to adapt using this example from World Health Organization manual of bubble CPAP, continuous positive airway pressure, utilizing an oxygen concentrator. And this can be effective in some of these preterm babies with surfactant deficiency in a low resource setting where we don't have surfactant, we don't have blood gases, we don't have a lot of the mechanical ventilation and other support equipment, but we can do still quite a lot to make a difference. And thankfully these triplets grew up to be healthy children. The integrated management of childhood and neonatal illnesses has also been a very important system that has helped in the communities as well as hospitals to develop multidisciplinary approaches to symptoms and syndromes. We're going to tell you about the Mother's Waiting Home initiative that has made a big difference in Kisisi. And we're going to talk about the Community Health Insurance Scheme that again has proved to be universal health coverage in action. And we hope these practical examples will stimulate you to think about such systems and how they can be organised. We'll also talk about IT and how that can be supporting insurance schemes, healthcare and standards. For example, integrating clinical guidelines to make them accessible to frontline workers so that they're practicing good medicine. And all of this will aim to achieve life in all its fullness. So thank you for joining the first day of the Developing Health course. We hope you're really going to enjoy it. Thank you.